Like much of the rest of the country, Missouri is in the middle of the #1 public health crisis that our country faces, the opioid crisis. Governor Greitens has said this is a modern plague. I believe that to be true. What we found is that it affects probably 1 out of 3 Missouri families have been touched by this.
I don't like what I do because it involves losing a son. And this is like ripping my guts open and letting them pour out on the floor, and I guarantee you when I walk out to my car, I will cry because the wound is still there.
Please understand, tomorrow always brings the chance of a new day for recovery, and always reach out.
I would hope by the end of the week, end of next week, every single person in this room will have naloxone on them, because we'll tell you where to go, how to get trained, and where to get it. I want to put everyone, that is your next call to action, to get Narcan.
Then moving forward, we very much in this next session want to work upstream to increase provider education and to talk about the proper treatment according to the CDC of chronic pain and the proper opioid dispensing. And then we're going to be very intentional about working in those areas of the state, such as St. Louis and the regional area, on decreasing our number of fatalities by decreasing the amount of fentanyl and synthetic narcotics available.
With heroin brings fentanyl, and the problem with fentanyl is once the users have tried something that's got a mixture of fentanyl in it, that's what they want.
In Missouri, the hot spot is still St. Louis. 70% of deaths last year were in the eastern region of this state, with 50% of them in St. Louis City and St. Louis County.
We thought it was incredibly important to engage people at the local level, to listen.
Each of us has a role that we play in this, and we have to come together.
And moving forward, we really think that many of the solutions will be delivered at the local level.
One of the ways forward is prevention. It is not the only way, but it is a very powerful force.
What is going to help us to move forward is if we can connect the tremendous heart and the tremendous passion of people who have seen this crisis, who've been affected by this crisis, and then connect that to positive action in our communities. Together we can save lives.